I thought it was really important to read the New York Times yesterday cover to cover. Why? Well, I'm a masochist. I don't know. Wanted to torture myself. You know how once in a while we'll get a progressive or a lefty who will call this show and they say, well, I listen to you, Mike, because I want to hear what the other side is thinking and saying and believing. And I always appreciate that because it gives me a chance to try to, I don't know, enlighten somebody who doesn't see the world the way I do as to why I feel the way I feel. So it is important to listen to each other. It is important to kind of study and analyze the grotesque way the media seems to be almost cheering for the coronavirus. I don't want to believe that there are reporters and journalists doing that, but with the continual good news that America right now is experiencing compared to where we were a month ago, you'd think that'd be the big story. The death count is terrible. We're now, I guess, over 90,000 lives lost. It's a vicious virus. But in all of the measurable data, new infections, new deaths, daily counts, all of this data is down. Pretty dramatically down. Michigan, for example, a hard-hit state. Detroit was hard hit, I should say. Not one death reported yesterday. Not one. That's the first time that's happened. That's the first time that's happened. So I really wanted to go through this exercise of getting the tone, the theme of the New York Times. And I can tell you what the mainstream media, as exemplified by the Times, is all about. It is, well, yes, but. Yes, but. Yes, there's good news with the data, but it could come back. What about the fall? What about what Bright said last week? What about what Fauci is warning? Yes, but. Now, I get the concern and I understand and we all acknowledge the perils of this vicious virus. We need to protect everyone. I get the statistical probability of being elderly, having comorbidities, having other existing underlying conditions. But who cares if your loved one has diabetes or is overweight or has a heart condition? You don't want to lose your loved one. You don't want to go through this. So that doesn't really matter. What matters to me is the unwillingness of the mainstream media to cover the better news that this country and indeed the world is experiencing with the kind of vigor that they have covered the onslaught and the upticks. Here's a good example in the New York Times. And the reason I tell you this is it is important that you see how millions of people who are not like-minded get their information. There's this constant drumbeat about, people who listen to talk radio or Fox News are indoctrinated. They only see the world. Well, what do you think about people who read the New York Times? Here's a headline. Page 14, tracking an outbreak, the global response. As neighbors closed, Sweden stayed open. A deadly month shows how risky that was. Now, we talked about Sweden last week. To me, that's an interesting comparison. Sweden didn't lock down. They trusted their citizens to do what they felt was right. And by the way, I want to be very clear about what Sweden didn't look like. It wasn't like business as usual in Sweden. Many people did social distance and stay home. Many people did not go out into the communities, into the restaurants and the bars and all. But nothing was mandatorily shut down. So here's the article. Sweden stayed open. They had a deadly month. And when you break down the article and you read it, in Stockholm, big, busy city, right? Where the virus spread through the migrant communities, more than twice the usual number of people died last month. They don't give any data. They don't say what number in that article. They just say more than twice the usual number of people died. They think, well, what's the number? Is it terrible? What is it? No two countries are exactly alike, writes the New York Times. Swedish officials chose not to implement a nationwide lockdown, trusting that people would do their part to stay safe. Schools, restaurants, gyms, and bars remained open, with social distancing rules enforced while gatherings were restricted to 50 people. 2 months later, now you got to get into the body of the article to hear the big takeaway. Are you ready? Big scary headline. Deadly month. Sweden. Look at those dumb Swedes, what they did when the rest of the world stayed closed. Here's the kicker. 2 months later, Sweden has not seen the worst case scenario many envisioned. COVID-19 deaths have disproportionately hit the elderly and those in nursing homes, as is the case in most countries, but hospitals have not been overwhelmed. As with the rest of the world, it will be months or even years before the full picture of mortality emerges. Years? Oh, now we're going to look at what, 20 years from now to see how much damage COVID did? Do you see what they're doing? I'm not a journalist. I don't pretend to be. I'm a big mouth with a radio show. I'm an American. I love what I do. I try to share as much information with you as I can. I come in here truthful, my heart on my sleeve. Do you see what they're trying to do? Well, twice as many deaths as twice the usual amount of people died last month. Well, how many is that? Many thousands? Are the hospitals overwhelmed? Are they out of ventilators? Are they out of ICU beds? Because that's what we heard, right? Nothing left. New York Times. It was not the worst case scenario. COVID-19 deaths. Hospitals have not been overwhelmed, but now they're pivoting, and now the goalposts are moved to, we won't know for years what happened. This is garbage. You know it, I know it, and I suspect the New York Times knows it. They can't stand to report on the fact that the data is very encouraging, that deaths are going dramatically down around the country. They can't stand it. They are so afraid that we're going to have a recovery, and I wonder what's going on this year. Wonder why they might be rooting for America and the world to fail. I don't know. I can't think of anything going on this fall. Can you? Man, oh man, welcome in. It is Monday. There are good numbers. There is good news. Let's start with New York. Big epicenter of the outbreak. New York City was decimated by COVID-19. New York State at the top of the line. Here's the governor, Andrew Cuomo, giving an update yesterday about the number of deaths in New York.
Look how long it takes on the way down compared to on the way up. That's why those spikes are dangerous. Once you have the spike, coming down from the spike is a prolonged period of time. Number of deaths are down, 139. At a different time and place, if I had that news to deliver, that would be incredibly shocking to people. Only in this environment is it not shocking. And relative to where we were, it's good news.
He almost sounds wistful, doesn't he? Can you hear the emotion in his voice? 139 died. That would normally be. How many people do you think die in New York every day normally? I don't know that he's ever been shocked at, murders and abortions and suicides and heart disease and cancer deaths. Wonder how many people die. Wonder how many people die normally. Here's Alex Azar, the Secretary of Health and Human Services. He was on with Jake Tapper over the weekend on CNN.
Are they taking measures such as social distancing and masks that make this reopening work?
Yeah, Jake, I think your question is very insightful. We are seeing that in areas that are opening, we're not seeing this spike in cases. We still see spikes in some areas that are in fact closed, very localized situations.
Isn't that interesting? And that's true, incidentally, with all the data, if you analyze it and you pull it back, areas that are closed see spikes, areas that are open are not. Detroit, one of the cities hit hardest by coronavirus. Not one new COVID death reported yesterday. Now, again, that's going to go up, down. Every death is awful. Every death generally is sad and awful and painful. But where's the enthusiasm? Where's the optimism? Oh, I know. I know where the optimism is coming from. I know where the love of country is coming from. I know where the encouragement is coming from. It's coming from this guy.
I just want to make something clear. It's very important. Vaccine or no vaccine, we're back. And we're starting the process. And in many cases, they don't have vaccines. And a virus or a flu comes, and you fight through it. We haven't seen anything like this in 100 and some odd years, 1917. But you fight through it. And people sometimes, I guess, we don't know exactly yet, but it looks like they become immune, or at least for a short while and maybe for life. But you fight through it. But what we'd like to do, if we can, is the vaccine. I think we're going to be successful in doing it, and hopefully by the end of the year.
You get to make a choice what side you want to be on, I guess, politically. We're in this together as Americans, but you can either be on the side of optimism and enthusiasm and relief at the better numbers, or be gloom and doom. Say, yes, but you should be home. You should be cowering. You need to be afraid. Yeah, we ought to be concerned. Sure, it's okay to be afraid. It's a terrible virus. It's a vicious virus. And frankly, I believe there's steps we should continue to be taking right now. We should be social distancing. I believe we should wear masks in gatherings, particularly inside where other people could be exposed. I don't want anybody to be unknowingly exposed to this thing. I don't want anybody to be sick. I don't care what anybody's beliefs or ideology is. But the fact is, there's lots of reason to be optimistic, to be enthusiastic, and the media doesn't want to acknowledge it.